Welcome to another episode of Le Coin des Experts, the Experts Corner. Today, I have the privilege and honor to interview Dr. Alison Siebecker, who is also considered the SIBO Queen in the world. Dr. Siebecker has been specializing in SIBO since 2011. She's the 2021 Lifetime Achievement Award recipient from the Gastroenterology Association of Naturopathic Physicians and has been teaching advanced gastroenterology at the National University of Natural Medicine in Portland since 2013 and is an award-winning author. She's the co-founder and former medical director of the SIBO Center for Digestive Health, and her integrative SIBO protocols have helped thousands worldwide. Dr. Siebecker has a free educational website, which is called siboinfo.com. And for more information about her SIBO course for practitioners, you can visit siboprocourse.com. In this interview, we'll talk about Dr. Siebecker's own journey with SIBO, what SIBO is and its link with IBS, what are the main causes she sees in her clinic, what is a recommended approach with SIBO, why SIBO is still not well known in some countries, how to live with chronic SIBO, some case studies, some success stories, her main recommendations for someone who may suspect having SIBO, a message for practitioners who may not be trained in SIBO yet, and finally, Dr. Siebecker's take-home message. As a reminder, everything that is discussed in this interview does not intend to diagnose or treat a medical condition, so please ask your healthcare practitioner before implementing any new treatment. Welcome, everybody. Bonjour. Today, I'm very honored to have here with us Dr. Alison Siebecker. Thank you so much for accepting my invitation and to share a lot of precious information with our French-speaking and English-speaking audience. Thank you, Alison.
Thank you so much for having me. I'm so happy to be here.
Bonjour.
Bonjour.
Bonjour, everybody. So, Alison is of course, international renowned expert on SIBO. You've been studying and teaching SIBO to practitioners and also to patients for many years already. You've been one of the first ones, right?
Yeah.
About SIBO, yeah. Would you like to tell us how did you get into SIBO? What was your first, the reason why you started looking into SIBO?
Well, it's because I suffer from it. Although I didn't know that I did. I guess my diagnosis was irritable bowel syndrome, IBS. Honestly, I didn't get that diagnosis till pretty later in adulthood. I mean, gosh, it must have been mid 40s or something. But basically, I've suffered my whole life from gastrointestinal symptoms. They bothered me terribly my whole life. I had a constellation of abdominal bloating, abdominal pain. Sometimes it was discomfort, sometimes a lot of pain, keeping me up at night, and terrible food intolerances my whole life, always having to be all picky about my food and getting pain and discomfort after eating, and then also constipation my whole life. And so, I think what I did when I was growing up and as a young adult is I explored the mental emotional aspect because I guess no one has really known what to do about these symptoms that are called IBS. There's never really been proper treatment, right? And what is it? It's just a constellation of symptoms. And so doctors would say to me, honestly, things like you must be afraid of letting go of things because I had constipation, things like that.
That's what we used to say, right?
Right? I mean, it's like, it's not the worst to do some linking with emotional stuff. So, I did all kinds of therapy and everything. Boy, it sure helped me as a person, but it never did a thing for my gastrointestinal symptoms. So, eventually, I went through medical school, naturopathic medical school and everything. And then I was fortunate enough to just find out about this condition just when it had been barely no one knew about it. And I did a bunch of investigation because I was like, I think this could be maybe what I have. So it was enlightened self-interest, basically. And it was absolutely fascinating. I implemented one of the diets that we can use that really they can help symptoms so much. And honestly, in 24 hours, it was like 80% improved after 40 years of suffering. Then one day feeling better, so good Lord. And it just sparked my energy that is still a fire in me to help others who suffered the way I did. I don't want people to live their life suffering when they don't have to. So that is what inspired me. And I took a year off from practice of seeing patients just to study the condition. And then I went back to practice, and the rest is history. I've just been on an awareness raising, mission ever since. I think it's been about 15 years now.
Wow, that's awesome. That's amazing. And just to remind people that are watching this video what SIBO is, and also the link with IBS.
Yeah, the link is important because basically what it is it's been discovered and published and validated in studies that a majority of people with IBS, it's actually SIBO, that the cause of their IBS is SIBO. So SIBO is an underlying cause of IBS. I mean, we could kind of call them the same thing, except then there's a certain proportion of people, maybe 30, 40%, that their IBS is not from SIBO, and then it's from something else. Now, this is the thing about IBS, is that it's poorly investigated. There are all sorts of things that can cause IBS, the constellation of symptoms. Unfortunately, so many people, they don't get properly investigated. So other things would be like yeast overgrowth, parasitic infection, and things like that. But for the majority, it's SIBO, which is a bacterial overgrowth. So just what is SIBO? It's in its smallest definition, it's bacterial overgrowth in the small intestine, like it sounds. This isn't supposed to happen. We're supposed to have a lot of bacteria in our large intestine, not so much in our small intestine. And also, there are certain bacteria, it's been discovered now, which are the ones that overgrow. They're not pathogenic. They are normal inhabitants of the intestine, but they shouldn't be in that amount. They throw the ratio and the balance off and cause all kinds of problems. But now the definition's been expanded a little bit because we have subtypes of SIBO based on the gases the bacteria make. And so that's hydrogen, methane, and hydrogen sulfide. We could have combinations of that. But now the methane and the hydrogen sulfide ones, we realize that the bacteria, and actually it's archaea or methanogens that make the methane gas, that they can overgrow in the large intestine as well. So the definition is a bit broadened now. I still use the word SIBO to kind of mean all of it. There actually is a new name for the methane type of overgrowth, which is intestinal methanogen overgrowth, or EMO. And just in October of 2023, we now have official diagnosis codes for all these subtypes of SIBO and the EMO.
Oh, that's wonderful. That's really great. Well, this is about, the American research, right? Which is already progressing a lot since Dr. Pimentel, right? Kind of discovered, SIBO. This is not still that, it's not the case in France or Italy, unfortunately, in many other European countries, but, little by little. And we talk about that in a few minutes, possibly. So what is, so SIBO has so many causes, right? Plenty of causes. So SIBO is the consequence of something, right? Is it
Absolutely.
You present SIBO. So what are the main causes that you see maybe in clinic or you've seen?
Yeah.
Those years of seeing patients with SIBO.
I think what I saw a lot of was what is considered to be the majority underlying cause, or the most common, which is food poisoning, also known as stomach flu or traveler's diarrhea. I really did see a lot of patients that was their cause. And so just very briefly, what happens there is, we get this acute bacteria. By the way, food poisoning can be viral. That's the most common form. But we're talking here about bacterial, which is less common. But so, what happens is we get exposed to this bacterial acute infection, foodborne usually, sometimes waterborne. We're sick from that, often vomiting, diarrhea, very unpleasant. But that lasts, some days and goes away. And then what happens is either you're left with maybe even slightly different symptoms, and that's the SIBO, or you're fine for some time and then later develops the SIBO. And it's due to an autoimmune process, actually. So this is actually groundbreaking information. A lot of us think Dr. Pimentel should receive the Nobel Prize for figuring this out in medicine, because it's just incredible. It's kind of like how ulcers, it was discovered that a bacterial infection or overgrowth can cause that. So, right.
Yeah,
Helicobacter. So in essence, now we know that the majority of people who have IBS have an autoimmune situation from a bacteria, from an infection that was triggered. So that's one thing. But the other things that I saw a lot was honestly from medications. So proton pump inhibitors, acid inhibiting medicines. Honestly, in studies, they don't show that they are directly a cause, but what they seem to be is a very much a risk factor. Like maybe someone else maybe they had food poisoning, but it damaged basically what's going on, by the way, is it damages the migrating motor complex, the ability of the small intestine to make this movement that clears bacteria out. And that's really the physiologic reason so many get bacterial overgrowth, is they're not sweeping the bacteria clear every day in their intestines. Anyway, where was I? I was talking about PPIs.
PPIs, yeah.
So maybe somebody had food poisoning and it really reduced their that cleansing wave, migrating motor complex a little bit, but not enough to give them SIBO. Then they take the proton pump inhibitor, and that has a different mechanism. It reduces acid. Acid kills bacteria, and together they create the SIBO. I saw a lot of that in my practice, where people would have multiple things have occurred. No one thing was enough to give them the SIBO, but they built upon each other. Another one would be antibiotics. I had many patients who really felt they got their SIBO after taking antibiotics. And actually, there was a study that showed that can actually slow that migrating motor complex. So, and then things like Ehlers-Danlos syndrome. Now, I don't know how well that's known in France, but it's been a recent understanding in the U.S. For us, maybe I'd say in the last 5-8 years, that this is not a rare condition. Ehlers-Danlos syndrome and other hypermobility. Basically, the tissues, the muscles and the connective tissue really become lax, and that means the muscles can't do that contraction very well to clear the bacteria, and other things can occur in that condition. That is a real common reason, especially for women, but it can affect anyone.
I think it's becoming more well known now in France as well. I can't recall the percentage of people that suffer from this, but yeah, it's definitely another big cause.
Really like the link between Ehlers-Danlos and IBS is huge. It's so likely. Basically, if somebody has IBS or SIBO and they don't know why, that's one of the first places you want to look, along with, a past event of food poisoning. So those are some of them. Also, I would say hypothyroid. We know that hypothyroid, when the thyroid isn't working well, it slows movement. When it's overactive, hyperthyroid, often people have diarrhea. When it's low, they have constipation. So hypothyroid, so many people suffer from that. And then I would say the last thing, other than this combination of effects, is, I'm sorry, there's two things I want to say. Also, I did see quite a lot of people who would have SIBO from abdominal adhesions. These are scar bands that form in the intestine from, like a sports injury, a blow, any kind of injury, surgery, inflammation, things like that, like appendicitis. And surgery is really the thing I would see. A lot of people would come where they had abdominal surgery for some reason, and endometriosis, a lot from. Okay, and then the last thing I want to mention is mystery. Is like we didn't know. And honestly, I have devoted an immense amount of my career and time trying to investigate what are all the reasons, because there are still people that we just don't know why they have it.
Yeah. And as you said before, the same way I see myself, I mean, it's like a puzzle. So there are a few different reasons. Sometimes it's not just one cause. It's a few different reasons, a few different causes all together. So, yeah. And sometimes there's a trigger event, right? Like, gastroenteritis or food poisoning. So, yeah. But before we move further, as I told you, in France and Italy and some other countries, unfortunately, SIBO is not very well known yet. Why is that? What do you think? Is it because it's a relatively new research, just over 20 years? What do you think?
Yeah, first off, I think you're right on that. It's a very new field, when you compare it to other diseases. It is new. There are people who have never heard of the terms still of small intestinal bacterial overgrowth. I think also that the main researcher is currently in the U.S. And so a lot of the, research and information's coming out from the U.S. that might not be reaching other countries. I know there are researchers in other countries. I mean, Italy had some of the first research on the main antibiotic that we use. So certainly there's people involved there. I know quite a lot of them. But, another thing is, like, for instance, like, for instance, I have a free educational website on SIBO, but it's in English, right? And so people from other countries who may not speak English, they may not be able to catch up on everything that's going on in the U.S. And it's a lot of it, the information is coming from the U.S., some from Australia. So I think that's part of it. Also, we in the U.S. have a hard time getting this information just to the general, primary care practitioners and even gastroenterologists. Early on, and honestly still, many doctors, especially gastroenterologists, said that they don't believe in it. And a friend of mine always makes a joke, it's not a religion. It's not something you believe in or not. We have, so much research factually proving it. But when someone forms a bias early on, when not all the research is there yet, well, then they're not going to look at it anymore. And they don't know the 20 years of research or even the 5 years of research. It's an emerging field. New research comes out about every 6 months that changes things because the discoveries are being made now. So if you're not following that, you've poo-pooed it, and then you don't know what you don't know. So we have an uphill battle here, but we're working on it right now by this interview.
No, thank you so much. Yeah, this is so true. Thank you for sharing your thoughts. And hopefully more and more people will train in SIBO, and hopefully more doctors and gastroenterologists will be on board, because they see all these patients. They see all the IBS patients first and foremost. So it's time to update, the information. So now let's get a little bit into your approach. What is your approach with SIBO? I know you have a very systematic approach, which I studied, of course. Can you tell us more?
Yeah. So just stepping back generally, when we look at this condition, or maybe most conditions, I see sort of 3 levels we can deal with. We can deal with the symptoms on the top. That's not unimportant. We need to make sure people are feeling better symptomatically. We can deal with the bacterial overgrowth itself and the methanogen overgrowth itself. And so for that, we're going to use antibacterials, obviously, to bring those numbers down. And then at the deepest level, we have the underlying cause, which we were just talking about. So the main approach that I recommend is doing a test. We can talk more about that later, making sure a person has it. We use the test to guide our treatment. And then we give antibacterial treatments. And there's 3 main ones that we can use: pharmaceutical antibiotics, herbal antibiotics, and elemental diet. So we give those antibacterials. And then we use things like prokinetics. These actually stimulate that migrating motor complex to sort of hold gains we've made. And then let's hope someone's better. If they're not better, we often need more than 1 round. We'll often retest to make sure, is the condition still there or not? And then we use more than 1 round. That's a key thing that's different about SIBO than a typical sort of bacterial condition you might treat. We need more than 1 round of antibacterials in many people. But one way or the other, once we finish with that, then let's hope that a person's all the way better. Unfortunately, we have some statistics that let us know that the majority of people with SIBO, it's the same for IBS, will relapse, meaning that it's chronic. And why would that be? It's because the underlying cause is still present. So if a person relapses, then we know they have a cause there. And that's when we need to go looking for that underlying cause and treat that root level. So that's the general approach. Is like, at first we just straight up treat the bacterial overgrowth. If someone relapses, we try to look for the cause and deal with that. And a lot of times that will take referrals, because various conditions that can cause it might not be each doctor's specialty,
Sure. So it's not a straightforward. It is straightforward way of approaching, but then the treatment can follow different ways, right? And so talking about treatment in particular, of course, we can use, you can use allopathic medicine, so real antibiotics, and you can also use, of course, herbal antibiotics. What's your overall thinking or view on, using it? Do you use some more than others?
Honestly, I found that I used them almost all equally. Generally, I would say I used, between the three types, but generally I'd say I used elemental diet a little less, only because it's a more challenging treatment to do and patients didn't want to do it as readily. What an elemental diet is it's a powder of predigested nutrients mixed with water. So it's basically a medical beverage. And the idea behind it is we feed the patient, the person, but starve the bacterial overgrowth because the nutrition's being absorbed so quickly, they don't get any of it. And you do it for 2 weeks, just like you would a pharmaceutical antibiotic. And so it's kind of like a form of fasting. Even though the nutrition is coming in, you're not consuming solid food. So patients, that's not their first choice. So only because of logistics would I do that one less. But because I have options of all three in my scope of practice here, I found it was very successful to rotate between the different treatment options and not just stick with one if you have that available. There are many practitioners who can't prescribe pharmaceutical antibiotics, and the very good news is that there are these two other options. Across the board, all three treatment types work the same in effectiveness. There's not one that's better than another, except for one thing, which is that the elemental diet has a slight advantage in that it can reduce a larger amount of gas or a larger amount of the bacteria in one round of treatment compared to the other treatments. But then it has that challenging aspect. So there's a pro and a con there. But, across the board, they're all equally effective. It doesn't matter what you choose. They all work.
Yeah. And still, when we think about, pharmaceutical antibiotics, we know that rifaximin is a good antibiotic, right? Because it only acts in the small intestine.
Such a good point. Yeah, this is one thing that's so important for people to know. We're so fortunate that the main antibiotic we use it's actually considered a eubiotic or an antibiotic with eubiotic properties, meaning positive properties. It actually increases lactobacillus, bifidus, and fecalibacterium in the large intestine after using it. So it's incredible. It's an antibiotic that can increase the probiotics in the
only one, I think.
The only one that I've ever. It is so unique. And it doesn't cause yeast overgrowth and it has all these other amazing properties. It's anti-inflammatory. So, but it can be, first of all, you have to be able to prescribe. And second of all, it can be very expensive depending upon the country and the insurance. Yeah. So
but I didn't know that it was actually discovered in Italy. That's what you said?
Yeah. Mm-hmm. Yep.
Okay.
It was.
That's why it's pretty well used and common in Italy.
Yeah, it has good acceptance there. The other unfortunate drawback, though, is that not with rifaximin, but we mentioned earlier that there's these three types or subtypes of SIBO, and we use different pharmaceutical antibiotics and herbal antibiotics based on those gas types because there's different bacteria making the different gases. So we need, you need different agents for that. Well, the antibiotics we need when you have methanogen overgrowth are neomycin or metronidazole, and those are typical antibiotics that can have typical side effects and drawbacks. I still use them. We do what we need to do. And honestly, they work amazing. And of course, people can have side effects. I've seen side effects to everything I've ever given, honestly. you give enough things long enough in practice, people can react to anything. But across the board, I'd say they're generally quite well tolerated and they do a fantastic job. But they have their cons.
It's interesting what you were saying, that people can react to anything and everything. And when we talk about antimicrobials, even natural antimicrobials, I often see, not often, but sometimes I see reactions to berberine, right? So it's it can happen even with natural things. So that's very interesting. Thank you for sharing your thoughts on those. And so what? You mentioned chronic SIBO, right? Which is pretty common, actually, chronic SIBO.
Yeah, I mean, statistics are 2/3 of cases. So
what do we do with those? So people, do you have anything that you may like to share with us?
Yeah, I mean, what we do for general management is we use Prokinetic, which I mentioned earlier. These are motility agents. They can be used in diarrhea patients because what they're really stimulating is the migrating motor complex in the small intestine. That doesn't travel through the large intestine and create a bowel movement. They're not laxatives. So their whole purpose is to create the migrating motor complex wave. So people don't really feel them a lot of the times. Sometimes they feel them in that they can tell they feel just a little better when they're on them. And depending which one's used, we have, just like the antibacterials, we have pharmaceutical options and herbal or natural options. So that's wonderful. But this really helps. A study was done by Dr. Pimentel, who's done most of the work on this condition, that showed that we can increase the remission time by an additional 8 months in someone if we add a prokinetic versus no prokinetic. That was, across the board. Obviously, there's individual variation, but that's amazing. This is something we definitely want. So what we generally do is we go on some kind of a reduced carbohydrate diet. The diets for SIBO are all reduced carbohydrate diets. And we use the diet in whatever, try to customize it to the person. If they have a chronic condition, we can customize over time and really make sure what is it that they can tolerate and what can they not tolerate. They don't have to follow the diet like it's written exactly. So we use that to manage symptoms, any remaining symptoms, and the prokinetic. And then I always recommend, if anyone can afford it and tolerate it, some kind of body work, like visceral manipulation, or it could be acupuncture. But body work really helps in the preventative phase. So that's generally what we do. But of course, the key is, can we figure out what the cause is, and is that treatable? A lot of the causes are currently incurable, so then we just have to manage ongoing. But I guess one thing I'd want to say is it's not a bad picture. Most people who have chronic SIBO are 80 to 90% better in their symptoms. Like, they live happy, productive lives with good management.
Yeah, this is awesome what you just mentioned. And also, just getting back to the diet, something that you mentioned in your course, in your training, is that, we all have different bacteria, right? The two people with SIBO, there will be different quantities and quality of bacteria. So basically, the diet has to be, customized, because different bacteria eat different types of carbohydrates, right?
Yes.
So,
yeah, and that can be confusing. Diets are confusing. To try to figure out how to follow a diet is always hard. But whichever diet, we have a whole bunch of diets we can use for SIBO, but whichever one it is, they have rules, and those rules are meant to be broken, basically, because we have to customize. So, a diet might say, don't eat X food, and you find you never have a symptom when you eat that food, then you should eat it. It's fine.
Right. So thank you so much for clarifying this point, because I see so many people here in France that are just obsessed with the diets, whatever it is, Monash, your, SIBO diet, or, Nirvana, phase 1, phase 2. And they're just, sometimes they lose like 10 kilos, 15 kilos, because they follow this diet for 6 months, a year, and I think this is also something that maybe you want to mention. How long do you normally recommend to be on a SIBO diet for?
Well, I have to say, this is what we all saw in the beginning when we were treating SIBO too. We'd put people on these diets, and same thing. They'd lose all this weight. It would get scary, then their hair would start to fall out. And after any drastic diet change, your hair can start to come out. And, it was very disturbing. I think we all had to learn that the place for diet. Now, I'll tell you how long to be on it in a minute, but really, it's best to use it alongside the antibacterials, because if you really focus on diet alone, this is what can happen. You have too many food restrictions. But the antibacterials are meant to come in there and reduce that overgrowth so you don't have as many food reactions in the first place. And then you can eat a broader diet. So just keep that in mind. So many people focus, I think, maybe too strong on the diet. So how long? Well, for somebody who has chronic SIBO, they'll probably always be on a SIBO diet, but modified and expanded to their tolerances. So that's the key, is, you may not want to implement a diet until after you do antibacterials, so that you already don't have to be as restricted, or just maybe start it slower. Like, for instance, I have a quick start diet that just gives you some pointers, but isn't super strict.
Thank you. That's all.
Yeah.
Okay.
Yeah. And it's available on my website, which is siboinfo.com. Well, actually, it's not there right yet, but I'm getting it there. And probably by the time this is up, it'll be there. We can link it if you want, so people
Yes.
can grab onto that. But something, that just gives you some pointers to get the symptoms a little bit controlled while you get in there and treat the overgrowth. But so, I guess what I would just say is caution with being a bit too strict in following those diets. And I would say if you're going to be doing them at all, a 6-week period, 1 month to 6 weeks is enough to, that you have to start, I would really say start experimenting after that. I mean, honestly, in a week, you'll already have your symptoms down. You could already start bringing things back in.
Yeah, provided that, there's an antimicrobial treatment, right? That is looking at killing those bacteria.
Yeah, but honestly, even all of the diets, the way they're written, there's always, every single person I've ever seen, there's always something on whatever diet they're on that says that they can't have, that they actually tolerate. So you can...
Yeah, totally agree with you.
Yeah, you can begin experimenting. It's just, get the antimicrobial in there and you'll do better.
Yeah, I think it's just a matter that, from what I see here, and of course, not untrained, specialists that just recommend a diet without any other, treatment. And I think this is not the solution, right? Because the diet by itself, it won't get rid of the bacteria. So it will maybe starve them a little bit, of course, but the bacteria may still be there. So yeah,
such an important point. It's just a symptom management technique. It's like it's a supportive technique. It's not the bulk of the treatment we need to do.
Yeah, totally. Yeah. Well, I was, of course, trained by you, no, so I totally agree with everything you say, and also with what I see, of course, in my clinic. But so what would be your main recommendations if someone has, let's say, IBS, so suspecting SIBO? Well, what would you recommend?
Well, I think what a lot of people do at first, honestly, is they try various treatments to see if they help that are, basic interventions. Obviously, cleaning up the diet a little bit if somebody's eating poor diet. Those things can always be done first, like trying probiotics, fiber, prebiotics, things like this. But if that doesn't work, because honestly, those things will help many people. But if those things don't work, then it's time to figure out if it's SIBO or not. And then we do the breath test. And so the SIBO breath test, what I recommend is a lactulose 3-hour hydrogen and methane breath test. There's also one test available, but it's only in the US currently, that also tests hydrogen sulfide. So hydrogen methane 3-hour lactulose breath test. You could also use fructose if, I think lactulose is only hard to get in the US. I think it's easy to get in other countries. So run that test, and then you do need to know how to interpret it. I always recommend not going just by what the lab report says, whether it's positive or negative. There's some little niggly things there that you do need to know and get some training on that, and then go from there.
Yeah, so important. Thank you also for mentioning that, because sometimes people just, they receive the results and it's yes or no, and then depending on what criteria the different labs are using, right? And sometimes we have some false negatives or false positives, so it's up to the practitioners to interpret those. Yeah, totally.
Yeah, I wish it wasn't like that. I wish we had better, more standardized criteria that worked clinically. It is a bit of a unfortunate situation. It means that people do need to get a little extra training on how to interpret those breath tests, which is unfortunate.
Yeah, and of course, then there are the clinical symptoms as well to correlate with.
Of course, we didn't even mention that, but that's going to be all those symptoms I mentioned in the beginning, the IBS symptoms, as well as things like acid reflux, honestly, anxiety, nausea. But it's mainly going to be the bloating, pain or discomfort, and bowel movement changes, burping and farting, things like that.
All the nice IBS classic symptoms, right? And so today there are still many practitioners in the world and in France and in Italy that are not trained in SIBO. What would be your recommendations? What would be is there a message that you like to share with all these practitioners?
Oh, well, I just would hope and wish that they would get some training in SIBO. I know it's unfortunate that it's not offered in most of our medical schools, most of it. I mean, that I created a SIBO training that I teach at the medical school here where I am, but that's a problem. So it means you're going to have to get it postgraduate, right? And patients as well, they need education also. So I have courses, and so I certainly can recommend my courses. I have colleagues, friends and colleagues that have courses as well. Just get yourself some training on it. So, for my courses, I have both for patients and practitioners. For practitioners, I have a long training that's, complete and thorough if you're really interested and you see a lot of patients like this. But I also have a short one that's just, 3.5 hours to just get you in and out with what you need to know. So take a little time and educate yourself. It's so worth it because of the amount of patients that walk in the door, no matter what kind of a doctor you are, that have this condition. It doesn't matter what kind of practice you have. I'm sure you will see people that have IBS. And so you will do a great service to humanity if you take some training and learn how to help these people. That's my message.
Absolutely. I can only add that I trained with you and also with Nirala, but I did your long course, which is absolutely amazing. So worth it. And I cannot thank you enough for, what you're doing and all the super interesting information that you share with a lot of generosity. So highly, highly recommend. Absolutely. Would you like to mention maybe a few of your success stories? Or, you have, I'm sure you have plenty.
Yes, I can. There's two interesting ones I can think of right now. Maybe I'll use myself as an example.
Yes, please.
Because I have chronic SIBO. And so it's important, I think, to have a case success story of someone who still has it, right? I live a very happy, productive life. I am not inhibited. I used to be. I used to not be able to go to events. I was exhausted all the time from being up all night in pain and things like this. I couldn't go to eat at restaurants. I have a broad diet. I could eat anywhere. I still do follow a SIBO diet. There's things I don't eat. I know how to avoid them. So, I do relapse. I do have times where I relapse, and I just treat it with either herbals or pharmaceutical antibiotics, and I stay on a prokinetic. I'm on one long-term. Actually, I'm on two because one of them has other benefits for me. I'm on a prucalopride as well as LDN. LDN is not technically a prokinetic, and I really actually am on it because I also have environmental allergies, like seasonal allergies, and it really helps with that. So those things all help me very, very much. And so I would consider myself a successful story.
Absolutely.
I still don't know what my underlying cause is. And, here's me who's, spent years trying to learn all about underlying causes.
And I have to know what your cause was. No, you haven't figured
No, I have some suspicions. One thing is that I did have a serious bout of food poisoning when I was 5 or 6 that I remember. I did not have gastrointestinal symptoms when I was born. And after that, I did. So, that's when it started. So it seems like that. However, I didn't mention this. There is a test you can do, a blood test. I'm not sure if it's in Europe yet.
In some countries it is, not everywhere. So hopefully we will get it in France as well. Yeah.
Yeah, so that's called IBS Smart and IBS Check. And that test was actually negative, and it should be positive if food poisoning was your cause. So who knows? And then I actually have a co-infection associated with Lyme that is associated with causing SIBO. So maybe I'm working on that right now, and honestly, as I work on that, I feel better. We'll see, but I feel like I'm a success story because I'm not in pain. I mean, from the way I lived my whole life, I'm not in pain. My constipation is managed. I don't have a lot of symptoms. I have occasional bloating. It's not a big deal. I'm good. So that's one story. Another would be a friend of mine who's actually an MD doctor. She had Lyme disease, and Lyme disease is a cause of SIBO and very difficult to treat and can take years to get rid of. And she underwent treatment. She did not do standard antibiotic treatment. She did an alternative treatment. It worked. And then she followed that up with brain retraining. So she did Annie Hopper's DNRS, and she needed both of those. And once both of those were done, she has no gastrointestinal symptoms left at all, can eat anything she wants. And so that's a complete success story, which is amazing because Lyme is a hard condition to to deal with. So
Absolutely. Yeah. And talking about Lyme and SIBO, which one would you treat first? Would you go first with SIBO?
yeah, you can kind of do both. I mean,
Both?
I would say it's kind of helpful. If you treat the SIBO, you wouldn't want to expect lasting effects. So what I would say is get in there more so with symptomatic treatments. That's where the diet's going to come in, helpful. Not done in a massively restrictive way, but just in a way to, whatever way you can find the food triggers, get rid of the food triggers. That will help someone's symptoms. But then so you can do a little bit of that. You could do some herbs or whatever. If the treatments are too expensive, hold off and then focus on the Lyme, because what will happen is you'll just keep having chronic relapses until you get that Lyme managed. That's what happened with my friend. We would treat her SIBO, she would feel great, and it would come back all too soon, even if she was on a prokinetic. And when you see those sorts of constant relapses you can't get under control, that's when if you can, figure out what the underlying cause is and focus on that. Actually, I'll tell you one more success story. It's just someone I've been consulting with a small group, doing who take my patient course. We can meet, in a small group, and I help them. And she just followed the treatment we recommend. She has SIBO. She followed, I don't remember whether she did herbs or antibiotics. She just went through the treatment. She's better. She's all better. And it's been several months now. She's on a prokinetic just to make sure she doesn't relapse. By the way, we take those for a minimum of 3 months. You can stop it after that because, you might not relapse anymore. We just want to make sure we get someone through the vulnerable period right at first, But she says she doesn't need us anymore. That's exactly what we want to hear. She's like, thank you. Thank you so much. I'm done. I feel fantastic. And this is what happens to people. They feel better than they did, for years and years and years if they've been suffering. So I mean, just a recent one where she's like, thank you. I'm good. See you later.
That's awesome. Yeah. And it is true. We get those, I would say not easy case, but sometimes, some easier cases of SIBO. And then sometimes we get long lasting and more difficult cases. So that's life. But all in all, what I can share with you, Alison, is that, people get better, right? So that I think, if you want to share maybe a final take-home message for our, audience, what would you like to say?
Just to build on what you just said, is that there's hope, both for a patient suffering, if you're listening, and for practitioners who treat. There is hope. There are excellent treatments and methodologies now for IBS, for SIBO, and you don't have to suffer like this if you're suffering, and your patients don't have to suffer. It's frustrating for practitioners because we don't have many options to help these people. So there are treatments that work, and there's hope to getting your patients and for you to feel better. So please just, take the time to learn a little bit more about this. If you're a patient, bring this information to your doctor, ask them to learn about it. Doctors, just take a little time to learn more, and I'm telling you, you'll all be thrilled.
That was awesome. Thank you so much, Dr. Siebecker. So we're going to share all the details about your courses for practitioners, for patients, any other new things that you're launching this year in 2024. What can we...
honestly, one thing I'm doing is I'm not sure when people will be hearing this, but I've been working on my free educational website on bringing it up to current standards and giving it a facelift, so to speak. And so I'm excited. I'll be launching, my new website with even more, free information to help people and much more targeted. And I'm just thrilled about it.
Oh, that's awesome. Already there's a lot of information on your website.
Yeah, and I didn't mention it. I'll say it again. It's siboinfo.com.
siboinfo.com.
Of course, it's in English, so for French speakers...
That's okay. It's okay. Nowadays, there are lots of ways of translating, from one language into the other. So it's very easy. I'm sure that a lot of the French audience will be very interested and thrilled to read all these amazing information. Well, I'm so thrilled once again, and honored, Dr. Siebecker, to be here with you. You're one of my mentors. You're the SIBO queen, right? That's how we call you.
Whenever anyone says that, I'm like, where's the crown? I want the crown.
But it's there. It's there. You can't see, but it's there. Anyway, I can't thank you enough for being here today. And maybe we are going to catch up again in a few months or years. Who knows?
I would love to.
More updates on SIBO, on the SIBO.
I am honored that you had me, and I'm so pleased with the work you're doing. So thank you.
Oh, thank you again. Thank you so much.